And that's why we've developed Collagevita. I've been involved in developing the product for those reasons, to bring the product that has all collagen peptides that are necessary for our body, so collagen type 1, 2, 3, 5, and 10. They all source from organic and kosher certified and halal certified sources. They come from bovine, fish, and eggshells. And we suggest the 20 grams use of powder, so it is sufficient amount of collagen for the daily basis, and as well balances the protein intake as well. Doesn't have any sweeteners, no additives, no flavoring. So it's very easily dissolved in any liquid. It can be added to food, and it doesn't taste of anything. So it's almost undetectable in most of the form of taking it. So the goal for us was to create a practitioner-grade collagen supplement rather than consumer market product. That's why we don't have any fancy additives and small substances that will look good or be popular, but actually evidence-based dose and types of peptides that needs to be delivered. Another thing, as I mentioned, that we have an exact dose of 20 grams per serving. And the most important was to achieve the 20 kilodaltons peptides molecule. So the molecule, it's achieved with the technology called peptan, and that provides the molecules of the size of 20 kilodaltons. So that it's easily absorbed. It's not the size of the molecules allow for the direct absorption, and the product is not being cut or digested further. So we optimize the absorption and as well optimize absorption of peptides. So we can guarantee that those ready peptides, collagen blocks, are actually used for the tissues that we want. And those low molecular weight collagen peptides not only absorb very well, but some of them are rich in hydroxyproline and proline, and they are two main amino acids, and especially in combination, that activate fibroblasts. So then we have a secondary action of collagen supplements that by binding to fibroblast receptors, it initiate proliferation and extra production of collagen. It's almost like a signal to fibroblasts that there is abundance of collagen and they actually can produce more new collagen. So it works directly as well in a stimulation of the peptides. On next slide, I will show you a few research supporting that data, and especially data connected with the peptide source as bovine, fish, and eggshell. The next element that we introduced to collagen, it's a high dose of vitamin C. And again, many products on the market have additional vitamin C, but it's in a very low dose. And that is not going to make significant difference in collagen synthesis. We actually need optimal dose of 100 milligrams of liposomal vitamin C. And again, liposomal, not the crystal type vitamin C, which is easily absorbed and as well safe for the stomach and doesn't become crystallized, but activates in our body and helps to create new collagen. And coming back to collagen peptides and fibroblast stimulation, those are the peptide types from the bovine collagen, which supports the production of a new collagen through activation of fibroblasts. So proline and hydroxyproline, that combination, and hydroxyproline and glycine, those two peptides as well, those peptides, so those two amino acids together, are actually a trigger for fibroblasts to grow and boost production of collagen. When it comes to fish, marine collagen peptides, we have slightly different combinations. So it's proline and hydroxyproline as well. And then there are specific peptides like those three, which I'm not going even to try to pronounce now. And they stimulate further as well the activation of, in different pathway activation of fibroblasts. And then finally, very interesting, a new player on the collagen field, which is the axial membrane peptides. And they have actually, there have been recent studies showing that they have different, slightly even different way of stimulating collagen, and that is very important for especially collagen type 5 and 10, which is very unique and needed in tissue rejuvenation and helps with fibroblast migration. So how can we integrate the collagen in our clinic? So obviously, collagen on its own is a great recommendation for every patient over 25, and especially when they go through menopause or when they are on GLP-1 antagonists. But if we want to integrate them into any treatments that stimulates the production of collagen, ideally we want to introduce the treatment the collagen 2 weeks before the treatment, and then sustain it during the course of treatment, which is usually on the 4 to 6 weeks intervals. So it comes to about 4 months of full dose of collagen and preferably as well vitamin C. And then after that, we can change into maintenance phase. Saying so, a lot of patients, ideally they should stay on this for their lifetime, especially that there is nothing harmful in the product for them, which would make it limited in the use. But some patients, if they want to make it a little bit easier, or they travel or they cannot commit to it, they can go on the maintenance phase where they use either a smaller dose or less time during the week. But then whenever they go through another treatment, I would definitely recommend to increase it again. Now as a obviously clinic and as a medical doctor, we've been involved in research, and in the clinic we have done a study in which we had 2 groups of patients. First group was of 10 patients which had only biostimulator. In my case, it was PDLA biostimulator. And the second group of 20 patients, which we treated with the same protocol of PDLA. So we didn't change anything in terms of injectables, but we have added the home use of collagen to support collagen production. And in those 2 groups, we have measured, obviously we had a score of excellent results, average to to good, and non-responders. And it was based on questionnaire, our assessment, and as well photography. And as a result of it, it was quite obvious that actually the support of collagen works extremely well in terms of improving the results of our treatments. And in protocol, in the protocol without collagen supplementation, we had 20% of excellent results, 60% of minimal to good results, and then 20% of non-responders. So people who we didn't see any improvement after the treatment. In group 2 with the collagen supplementation, we had 90% of excellent results and only 10% of minimal to good results. We had no responders. So we noticed, obviously, there was very obvious feedback from the treatment that results were far better, the predictability much higher. The patient's outcome obviously improved and the recovery shortened as well. And what is the most important, that as well the longevity of results improved. So as much as we have that initial quick response to the treatment, as well, it stays longer, so the skin it's improved for longer. And in that way, the satisfaction of patients and the trust highly increased. And actually, we had a very, very, very successful clinic based on that. I will share with you some of the pictures before and after of those two groups. This is a first lady who was treated just with biostimulator. Actually, she had a good result, or excellent results, with a good improvement of the skin quality and lines. But another one, which had the same amount of product and the same protocol, had a much younger, didn't respond so well at all. And finally, we've done the treatments on different skin types, and as well on this lady, we didn't have much improvement. After changing it to the protocols with collagen supplementation at home, we have seen significant increase in improvement and results, as you can see on this picture, with improvement of the volume, skin texture, quality of the skin on the lower face and the neck, but as well around the eyes. So generally, significant change in results. And this patient, for example, as well had a significant, she was a weight loss patient with very low protein amount in her body, in her blood, and we could not shift it with any treatments. We used all sorts of modalities, and only by adding the collagen, we've managed to improve her skin quality to significant level, especially on her neck. And this is an older patient who normally I would be very nervous to advise biostimulators on their own. And as a close-up, you can see significant improvement with the skin around the eyes, on the lower face, especially on those smile lines, and as well lift along the jawline. And again, she responded very well, obviously, to biostimulators, but only because she had a capacity to do so, because we gave her supplements of collagen at home. And there is another patient in the late 40s, responded like great to the treatment with amazing skin quality and the glow. Another one, the same improvement of the skin quality, especially seen on the lower face, smoother and firmer and more full skin. And then another patient of ours, which responded really well with tightening of the skin and significant lift in mid-face and increase of collagen and elasticity in the skin. And finally, lady in her late 60s, which responded again very well to the treatment with lift in the mid-face and skin quality. That's why, so from what we see, I would say that I recommend the collagen to all my patients. But when it comes to assessment and focusing on who actually must take it, I would suggest something like a collagen readiness score, which is easy score to introduce to a clinic, and things like age over 40, menopause, GLP-1 use, rapid weight loss, hair thinning, previous poor treatment response, smoking history, or skin laxity would account, each of those would account for 1 point. And if there are more than 3 points, then definitely is a candidate for the collagen supplementation on its own, or with the treatment, with our treatment support. As I mentioned before, every patient would benefit with it, and we will actually see better results. But this is a group that should be not even discussed. And I would refuse in the clinic to do the treatment unless I prepare them holistically for the treatment. And how we can, we are just introducing, obviously, the Collagevita with Wigmore, but we have certain things that we can help clinics or practitioners to introduce this product to the clinic, and be very happy to answer all the questions and provide all the support that you need. And as a summary, I just wanted to add that Collagen stimulation, obviously, is only one side of equation. And the second, even more important, it's the biological capacity of our patients to respond to production of collagen. And we shouldn't only focus on stimulation, but as well, it's very important to support our patients to produce new collagen. And a combination of advanced treatments and evidence-based collagen supplementation can definitely optimize patient outcome and treatment longevity, and obviously satisfaction of our patients.